have to wonder, is the GOP pushing President Trump into some sort of trap? Joining me now to discuss, Tammy Bruce, Liz Peek, Katie Frates, and Ford O Connell. I'm going to start with the ladies in studio. Tammy, listen, I'm being lured into this, but it's starting to feel like more and more something nefarious is afoot.
Well, look, you've got an entire cadre of Republicans who have made it very clear they don't like the president. They've got a different point of view about government. And it's interesting with Ted Cruz, normally I would say, well, he also is not very fond of the president. But remember, within the last week, he was at the White House. And he had a private meeting with the president. His daughters were in the Oval Office. And now suddenly you're hearing very, very strong comments from Senator Cruz against the bill. So I think that something, look, none of us, people like me, Tea Party type people, don't like Paul Ryan. We don't think that they're suddenly on board with President Trump. So there's room for that, to think that. At the same time, the general sense now is that that third part of the bill of what President Trump imagines will never actually even happen. And look, I understand that. I think that whatever President Trump wants to have happen will, but at this point, the machine is so allayed against him, I'm just hoping that he, in fact, he's not a naive man, that he's engaged with this and is in front of it.
He's not a naive man, but he does want to get things done. And since Obamacare is first, they need to knock it out to get to the rest of the agenda, Liz. And of course, you know, we've been told over and over again that this is just the initial stage. There's a lot of negotiation going on, a lot of it in public, some of it behind the scenes. But I think there's a reason to be concerned with this plan.
Look, let's go to the part where Ted Cruz says if Republicans don't get this done, since they have Congress and the White House, they're going to look incredibly stupid. And I would use that as a starting point. I think all this backlash against the bill basically gives conservatives cover, and frankly, the report that came out of the CBO gives them cover. What does this bill do? It cuts Medicaid for the first time in decades. It reduces the deficit by $300 billion plus. What's not to like about that? Look, in a perfect world, everyone gets free health care and there's no cost. That's not going to happen, so there has to be accommodation, there has to be compromise between, by the way, what Donald Trump campaigned on, which was not taking the rug out from under people and keeping a lot of the popular parts of Obamacare. They have to get a bill that satisfies a lot of different constituencies. I think this is typical of a messy process of legislating, and we just haven't seen it in a while.
All right, Katie, you know, there was a lot of headlines in the Washington Post. One that caught my eye is that Reagan Democrats give Trump a long leash but deeply distrust the GOP. I think that's right. And I think if this fails, it falls more in the lap of Ryan than it does President Trump. Nevertheless, there's serious concern that the Ryans of the world, the establishment types, just aren't looking out in the best interest of President Trump nor the American people.
Well, and part of this, of course, is that they've been handed the entire government, and you don't want to show your base that you can't get anything done. But at the same time, you don't want to pass something that Democrats can then beat you over the head with, like we did with Obama for so many years. So I think, you know, Cruz has a part trying to protect himself, and some of the other ones too. But you don't want a Herbert Walker Bush-style lemmings off a cliff following of all the Republicans in his expansion of government. You do. I'm not upset by people speaking out against this and speaking their minds. I think that's healthy to have debate and have compromise. I think that's good. But at the same time, it does look like we're just infighting with ourselves when we're supposed to be getting things done.
Speaking of infighting, moments ago, Ford, Paul Ryan said that Senator Rand Paul was insulting President Trump by saying that he was being sold a bill of goods that wasn't explained to the president. Listen, I guess that's a good way to provide yourself with cover, but there are some legitimate concerns about this. Liz's comments notwithstanding, some people are concerned about the tax credits, the essential benefits, and some of the other things, taxing, keeping kids up to 26 on the plan, pre-existing conditions, all of the things that ultimately make it really tough to ever bring down the cost of health care.
Well, look, let me say this. I think that conservatives like Ted Cruz and Rand Paul need to shut their mouth and understand that their political standing and their livelihood rests with Donald Trump standing with the voters and his ability to get things done. We need to actually demonstrate a little bipartisanship within the Republican caucus and understand that Trump is not elected to be a doctrinaire conservative, nor was he elected to be the president of the Republican Party. He was elected to get things done and do what's in the best interest of the people going forward. And something else. I disagree with Katie about the George W. Bush comparison and the Barack Obama comparison. Democrats are only concerned about one thing here. That's not cost. That's Medicaid expansion, and we're going to take it on the backside no matter what. We just have to make sure that we have a peaceful transition to a free market situation.
All right, guys. Now, House Ways and Means Committee Chairman Kevin Brady met with the influential small business roundtable today. Of course, the goal there is to woo these CEOs on the benefits of the GOP health care plan. I spoke with a congressman a short time ago about all the pushback that his bill is getting. Take a listen.
Well, I predict at the end of the day we come together because the alternative is keeping Obamacare, all the taxes, all the subsidies, all the mandates in place, and it's hurting a lot of people. So I think the key here is, look, there's different approaches between how much to spend on Medicaid going forward and when to begin to give states much more control. We have to work that out and will.
It's interesting because, Tammy, he was really pushing back on Republicans in the Senate. You know, so interesting that Ford talked about bipartisanship.
Right.
And because, listen, the Senate Republicans have said the House is more or less tiptoed through this thing. They weren't aggressive. They didn't take advantage of a lot of the levers they could have pulled. And now they're trying to save it all up for the third phase when the Senate steps up to the plate. So there's a lot of fighting going on there as well.
There is. And when you've got a small business leaders meeting, one thing we've talked about a lot on this program is that the market and business doesn't like uncertainty. And this internal fighting does not help. President's approval ratings going down, and it's going to be more difficult. You know, we've got these great numbers so far in the country with business and with the market because people have had a sense that President Trump will get these things done. But now there seems to be an inkling that something else is afoot, and this is where it has to get cleared up. So it's interesting when you're looking at whether it's the head of Anthem, the insurance companies themselves. I don't even know how they can kind of get a handle on the nature of what's going on until the Republican Party unites on any messaging, and right now they haven't.
And I think Anthem, which is the second largest health insurer, but the one with the greatest exposure now to Obamacare, likes this current bill. But, Liz, do we forget that President Trump was elected to wreck Washington, D.C.? In other words, maybe to change the way everything is done on both sides of the aisle, and maybe that's where some people are getting antsy, that, yeah, okay, it's good to be negotiating and it's good to play ball, but we want you to go in there and we want you to upend everyone, particularly the establishment.
Yeah, someone put a piece out, maybe in Politico, talking about how, you know, what's he doing going through reconciliation? Why is he going through the traditional routes? Well, that's how we make legislation in this country, and that's how we create laws. And when you're sitting at the Oval Office doing it one-handed with your pen and your phone, that's what Obama did. People don't like that. So, look, I give him credit for teeing this up. I think this will get done. By the way, I think, you know, Thursday, tomorrow is the markup on the bill. You know, let's see what kind of compromises are made. I think it's great that an insurance company came on board. Today, the Wall Street Journal had a pretty positive comment. Look, we're going to get some support for this. It isn't perfect, but you can't make perfect the enemy of good.